YouTube channel. I'm Dr. Aishma and today I'm going to be talking about OET or Occupational English Language Test. So many of you might be familiar with this test, especially if you're preparing for your USMLE or PLAB examinations. So you need to pass your OET in order to be ECFMG certified or in order to give your PLAB 1 or PLAB 2 examinations. So OET basically comprises of 4 tests: reading, listening, writing and speaking assessment. So many of my friends and colleagues have expressed their concern about OET speaking assessment. It's a common misconception that you need to be a native English language speaker with a very good British or American accent in order to get an A in your OET speaking assessment. However, this is not the case if you know what you're being tested for. So today I'm going to share how you can get an A in your OET speaking assessment without being a native English language speaker. Let's get started. So there are basically 2 major criteria. The first one is your linguistic criteria and the second is your clinical communication criteria. Now most of us are well versed with the linguistic criteria, which basically involves your grammar, your fluency and your pronunciation. But what we tend to miss on is the clinical communication criteria. Now OET is not just a test of your English speaking ability, but also a test of how effectively you can establish a communication with the patient. So knowing these criteria will definitely help you score better in your OET speaking assessment. However, they will also help establish a good doctor-patient relationship in real life. So let's have a look at what these criteria are. Okay, let's start with the linguistic criteria. So there are 4 criteria that come under the linguistic criteria. The first one is intelligibility, which includes pronunciation, stressing on words, intonation, and rhythm. Now, for example, suppose you have a patient with hypertension and you're advising the patient to exercise. So how would it go? Mr. Jones, I would strongly suggest that you exercise to help reduce your blood pressure. Here, stressing on the word strongly suggest delivers the information that you think exercise would help decrease his blood pressure, and it conveys the information appropriately. The second criteria would be fluency. Now your speech should be completely fluent and hesitation if present should be appropriate. Now hesitations are a very common part of conversation, and if you don't have any pauses in a conversation, it would make you sound rather robotic. So pauses are necessary. However, a very long and a repetitive would indicate that you are having difficulty finding an appropriate word to deliver your information. The third is appropriateness of language. Now, it should be remembered that you are a physician and explaining technical matters is a very sensitive material. For example, a patient may not understand all the technical information that you are providing, and your information should be conveyed in very simplified language. So let's take a scenario for example. You have a patient with asthma. So instead of saying, Johns, I suspect you have asthma, it would be better if you convey the information as such. So Johns, I suspect you have a disease of your airway and it's called asthma. Have you heard of this term before? The fourth criteria would be resources of grammar and expression. Now it's understandable that our grammar isn't correct all the time and minor mistakes are tolerable as well. However, gross mistakes in grammar, mixing up of the tenses can reduce your score. Here, using an idiomatic expression or two can help improve your score. For instance, let's say you have a patient with hypertension who is also morbidly obese. So what you can say here is, Mr. Smith, I strongly suggest that you exercise. It would help reduce your blood pressure and also to reduce your weight. It would be like killing 2 birds with 1 stone, isn't it? So this wraps up our linguistic criteria. Let's move on to the clinical communication criteria. So most of us are not aware about the clinical communication criteria. These are 5 criteria and knowing them would definitely help you improve your score. So the first one is relationship building. Building a good relationship with the patient is very important to establish a good physician-patient relationship. It will help the patient open up better and to explain what they are going through. The first would be through a good introduction. It would go like, Good morning, I'm Dr. Samantha and I'll be your treating physician for today. May I have your name and date of birth for verification, please? The second would be to demonstrate that you're attentive. Since OET speaking examiners just listen to your conversations, it is very important that you convey that you're attentive through your speech, using phrases like, oh, I see, yeah, sure, okay, it makes you sound attentive. The third thing is adopting a non-judgmental approach. Since the patient is sharing vital information with you, some things that they may not be proud of or think that they'll receive a lot of judgment. So it's up to you as a physician to make them feel comfortable and that to let them know that you are here to help and not to judge. For example, if a patient says, "Doctor, I haven't been adherent with my daily medication," you can respond by saying, "I can understand it must be very difficult for you to remember taking your medications daily, Mr. Smith. If I were you and if I were in your place, I would have had the same difficulties." The fourth thing is showing empathy. Now, showing empathy is a very important aspect of a physician's profession, and it must be very clear and evident in your conversation. So, for example, if a patient says, "Doctor, I have a pain in my stomach since yesterday," your first response should be, "Oh, I'm so sorry to hear that," rather than immediately asking him what the nature or character of his pain is. Okay, so the next criteria is understanding and incorporating the patient's perspective. Now, before bombarding the patient with many information of your own, it is important that you know what the patient thinks about his or her condition, what his or her concerns are regarding the condition. For example, you diagnose the patient, Mr. Smith, with colon cancer and you suggest that he undergo a procedure known as hemicolectomy. So the patient can be worried about the outcome of the treatment, the mortality of the disease, or the side effects of the treatment. So what you can say is, "I can understand your concern, Mr. Smith. However, I assure you that I have treated around 100 patients with this condition, and the success rate of the operation is 98%, which is a pretty good number. So you are in good hands." So this helps to address the patient's concerns, and it relates to the patient's expectation of the condition or expectation of the treatment that you're providing. The fourth criteria would be providing structure. Now, it is very important that you sequence the interview. As a physician, it should be you who should lead the conversation in such a way that you utilize the amount of time that you have to convey as much information as you can without confusing the patient. The second important thing is signposting changes in topic. So let's take an example. "Now that I have discussed about the causes of your pain, is it okay if we move on to the treatment of your condition, Mr. Smith?" So signposting clarifies that you have finished discussing one part of the conversation and now you're moving to a different part of the conversation. The third is organizing techniques and explanation. For instance, you have a diabetic patient and you would like to discuss about the treatment modalities to this patient. So how can you provide a structure to your conversation here? What you can say is, "So Mr. Smith, there are two types of treatment modalities to your condition of diabetes. Number A is non-pharmacological approach and B is a pharmacological approach. Which one would you like to know first?" So this is how you provide organizing techniques and explanation. The fourth criteria would be information gathering. Now, you have to facilitate the patient's narrative and you have to let the patient know that they are being heard. It's very important that you use open questions first and not use leading questions or compound questions to confuse the patient. For example, if the patient says that they are having a pain in the abdomen, what you can say is, "Can you elaborate further on this pain that you're having, Miss Smith?" Instead of directly asking them what's the site of their pain, what's the character of their pain, and if the pain is radiating or not. Now, you have to clarify the statements if they are vague or if they need amplification. For example, if you are using some technical term to explain to the patient, for example, you recommend a CT scan of the abdomen to the patient. So what you can say is, "So Mr. Smith, I advise you to undergo a CT scan of your abdomen. It's like an X-ray, but the image is much clearer." The last criteria would be summarizing the information to encourage correction and invite further information. Now, this is very important because it helps you to repeat important information and also helps to understand if the patient has any confusion regarding the information that you just provided. So, for example, if you've just discussed the treatment options for hypertension with the patient, what you can say is, "Now that we have discussed the different non-pharmacological lifestyle modification approaches to hypertension, are you following me so far, or do you have any queries for me till now?" So this is how you do information gathering. The last criteria would be information giving. Now, it is very important that you establish what the patient already knows. Let's say, for example, that a patient has asthma. Mr. Jones, I suspect that you have a condition called asthma. Have you heard about this term before? Now, asking this to the patient helps the physician to know how much information needs to be given to the patient about the condition, or if there are already some pre existing misconceptions regarding the disease that you might need to clear with the patient. It's also important to periodically stop when you're giving the information and encourage the patient to contribute his or her reactions or feelings to the information that you're providing. For example, you tell a patient that he has cancer. Mr. Smith, it's unfortunate that your reports aren't very promising. They show that you have colon cancer. How do you feel about this? This is asking the patient about their feelings and contributing reactions. Now, it's also important that you check whether the patient understands the information that you're providing and discovering what further information the patient needs. For example, you could do this by just saying, "Do you follow me so far? Am I clear to you till now? Do you have any questions so far?" Lastly, what you can do is you can end the conversation by summarizing the points of the conversation. So, if you don't have any queries till now, is it okay if I summarize the key points of our conversation, Anna? Or if is it okay if I go through the highlights of our conversation today, Anna? So this is how you wrap up information that you've provided to the patient. So you don't need an excellent command over the English language in order to get an A in your OET if you know what your examiners are trying to test you on. And knowing all these points doesn't hurt either, because it helps establish a good doctor-patient relationship, makes your patient feel comfortable and easier to open up. And that's what we all want in the long run, isn't it? If you have any queries, any suggestion, or anything that I might have missed, please drop it down in the comment section below. We'll be back with my next video. Please like, share, and subscribe.